The Strength Beyond Struggle podcast brings you mental health stories from the front lines. We're sponsored by Ending the Silence, a program by the National Alliance for Mental Illness, NAMI, funded by the Arizona Healthcare Cost Containment System. We bring you the stories of people with lived experience. We do not offer therapy for any mental health condition and cannot substitute for professional assessment and treatment. In every episode, we deal with difficult mental health topics, including suicide. So if you're struggling, remember, you can always get help by calling 988. Welcome. We're here with Kadi Tenney, who is a school counselor with the Payson High School, with the Payson Unified School District. Mm-hmm. And right now in this podcast with you, we're going to do another one too, but we're going to talk about the role that school counselors play in mental health, because it's over the years, you've said that it's actually been bumped up in terms of how much attention you're giving it. And so I don't know if people understand that. So a little bit. So how did you find your way to being a school counselor? Because that's a unique job.
So, yeah, just to speak to the way that it's changed, and then I'll answer your next question. Just traditionally, counseling we were called guidance counselors. There's still a lot of reference to that around the school, guidance counselors, and guidance maybe referred more to a counselor's responsibility to guide students to college and career. And so it was a little bit more academic based and career based. And we still do that. We still do a lot of academic and career focused things. But over the years, the label has changed to school counselor. And along with that is more of a focus on mental health, social emotional learning that goes along with that. Supporting students to feel, comfortable, safe in their learning environment, because we have learned over the years that it is hard for students to engage and be successful in school if they don't feel good, physically, mentally, whatever it may be. So that's how the role has changed. For me, I'm a mother of 4. My oldest just turned 27.
Congratulations. You do not look like you have a 27-year-old.
Thank you. So, and early, before I became a mother, I got a degree in psychology. My intention was to get a master's degree in some sort of counseling at some point. But then I used my psychology degree as a mother for many, many years, and a wife.
Did that work with your kids?
And it was a very handy degree to have. As you're navigating,
take note, everyone. Okay.
As you're navigating the very difficult role of parents, and
talk about a training ground, right?
Yeah. I've always had a huge passion for sports. I coached high school softball for about 15 years, and was very involved in my children's sports as they were growing up. I love physical fitness, and so I had a lot of extra training in that. And so at some point I became a PE teacher, and just kind of by accident. And then from there, it evolved into an opportunity to become a counselor. And so I got a master's degree in school counseling just recently. But I've been working, thank you. I've been working as a school counselor at Payson High School. This is my 4th year. Oh, wow. It's my 4th year.
Goes fast, doesn't it?
As a school counselor. So yeah, it's been great. And I really love it. And I think it all started back when I was in high school, and I had really great school counselors.
Did you use them for things more than career and counseling yourself? Or did you have a friend who needed them?
I was involved in a class called peer counseling, which I now teach and I love, where we learned a lot of skills to be mentors for younger students. You function as basically like a big brother, big sister program. So our peer counselors go to the middle school and the elementary school, and they have a little buddy who has a need for a role model in their life, and they function in that capacity. And I did that when I was in high school. And I think that was the start. That was the spark of wanting to, get into something where I could make a difference, where I knew that I had the skill and the love for other people. And so I knew that that was in my future in some capacity. I used it a lot of years, like I said, as a mother and a coach, but
your kids are
now I'm getting to extend that out a little bit more as a counselor. So
and I was thinking as you were talking about moving in this direction that you're moving, and I want to because I was raised with Midwestern parents that come from a farming background, and people who are white understand this culture. I've learned that people who are different cultures don't necessarily understand it as well as white people do, but in the white farming culture, mental health is not talked about. It is a shameful topic. I do know in the Black culture, I've heard that it's also a shameful topic, but you bring in prayer and drinking lemonade and rocking on a front porch, I've heard is part of it. With some of them. And so there's every culture has this idea that mental health is a shameful topic to talk about. But as you said earlier in the show, and I didn't realize you've gone from guidance counselors to school counselors. Thank you. How are you negotiating this shift in consciousness where I hear the young people in my job as Ending the Silence presenters say, oh yeah, YouTube told me all about mental health.
Sure.
Their parents are like, oh, that's a shameful topic. No, we don't talk about it. That's like Freudian weird stuff you're all guessing. So how do you bridge that as a school counselor?
So we get a lot, like you say, most students are very interested because they're more aware. Social media has done wonderful things for mental health awareness. Some parents are on board and have an understanding, but I would say probably more are wary of counseling, mental health, pharmaceuticals, anything that might be helpful for things like depression and anxiety, which is what we see a lot of. I think just like anything, you navigate via education. So often if I have a student who I feel like needs extra support and I want to refer them for outside resources, I will call the parent and ask the parent to come in, and I'll just have a conversation with them and try to educate them on what I feel like their child needs, their student needs for success. And it's usually fairly successful.
Really? I was going to ask you.
Occasionally there are times where, the parent has had some sort of bad past experience that has tainted how they feel about, counseling or therapy. But that's rare. Usually parents are just looking for something to help.
Yeah.
Some way that they can get some help for their
child.
Do
you have an example of a parent that you might have you can safely talk about so parents understand some of the concerns that parents bring up, some of the situations that might need their attention. Maybe that's even better. What are some of the things that parents can look for that you could tell parents, hey, this is what we're seeing in school, look for it at home? Is that what you do with the parents? I mean, besides the education, what else what do you teach them? How does that work? How has it made a difference?
So sometimes parents aren't aware maybe how the behaviors that their child is exhibiting are symptomatic of mental health issues. So a lot of times, I'll say, I'm not sure if you've noticed, but your student is feeling really sad a lot. Your student lacks motivation to complete their work at school. Your student is spending a lot of time in the bathroom, avoiding class. Your student is having trouble connecting with friends. I don't know if you've noticed that your student used to love, basketball, and now they're showing very little interest, or they're not getting as much enjoyment from basketball. All of these are symptoms of depression. And I'm concerned that is getting in the way of them finding success at school, but also in their personal life. So I feel like this is something that probably needs to be explored with an outside professional. Do you have a medical doctor that you can see? We start there. We also have resources. We have a really great district social worker. Sorry, I paused for a minute.
That's
I had to
okay.
think of what's she called, who connects us very well to outside resources. So I often use her as a reference point, especially because we have so many students whose parents can't financially afford to get them medical help, or mental health help, which is a lot harder to get, even if you do have insurance. So she's great at helping connect to resources that will support
So are you
students.
saying that parents shouldn't be afraid if they can't afford it? Parents shouldn't be afraid if they're ashamed of it. Parents should, and are you do you act as a guide or a support? I mean, what have you done for parents to help them through this process besides educate them?
So often, I mean, I can give an example, I guess, from last year. I had a student who had all of the signs of depression. He was using marijuana and vaping to sort of cope, right? That happens a lot. And he was getting into some trouble for that. But in my conversations with him, I discovered, well, there's some very good reasons that he needs to cope. There's a lot going on in his life, and he's coping with the depression that he feels, and he needs some way to work through the things that are causing the depression. And so I asked him if he would be open to seeing a therapist or a counselor, if he'd spoken to a medical doctor about the symptoms he was feeling and things. And he said he's open to it, but he'd never spoken to anyone outside of it. I asked if he'd talked to his mom. I knew in our conversations that he lived with his mom. He said no. I said, do you think she would be open to it? He said, I am not sure. So these are kind of the progression that we progress. So I said, would it be okay if I talk to your mom? Can I talk to your mom and see how she feels about it? We can go from there. Yes. Okay. So then I bring mom in and have the conversation with her. Here's where we're at. Here's how your son's feeling. He's concerned about himself. We're concerned about him. We think he needs some extra support. And so, of course, she's like, well, what are you talking about? And, we don't have insurance. And this is the most common thing. I don't, how do I pay for it? What do I do? Where do I go? Lots of questions. So that's where we come in with the resources that we have as far as being able to refer parents for,
like in Payson, don't we have Southwest
Behavioral is generally what we use. We do have some other places we can refer to for more severe circumstances.
But they're usually outside of town, correct?
But they're out of town. And Payson has improved as far as resources for like telehealth. And so even mental health, telehealth. And so people who aren't comfortable with Southwest Behavioral, which sometimes people aren't, or, have other issues where they don't want to be face-to-face, more convenient to be at home and comfortable.
Oh, they can do that now.
When you're having a conversation with a therapist via video.
Because when I was going through things with my daughter, and this was almost 10 years ago, that was not an option. But I mean, since COVID, I guess we've all improved.
Oh yeah.
Yeah. And so even that, and have you found that that's kind of, you said it's expanded and improved availability? Meaning
more doctor's offices in town have someone that they can immediately refer to. I know that Ponderosa Health with Dr. Michaels and Dr. Hunt, they have a great program that they're using that focuses on youth mental health because they do pediatrics. And so they were seeing a lot of the depression and anxiety things in their office and wanted to be able to offer services to people, to their patients. And so they found a group that they partner with, and the group meets with students via video, telehealth. So,
well, news to me. Thank you so much. And that's why it's wonderful to partner with you and work with you in the schools and find things, because our kids, they really need help now, don't they? Especially what I've had people walk up to me in the parking lot and go, why are you getting involved with this? What's the deal with mental health? Why is it such a big deal? And I tell them, the pandemic was the biggest trigger around the world. It changed everything.
Yeah.
And it did. I mean, now you weren't a counselor pre-pandemic, correct?
Correct.
but you are after, but you've been involved with kids, obviously 15 years.
Well, I was a teacher through the pandemic, so I've seen, the students.
And so maybe you could help the public understand from your point of view as a school counselor and working in the schools. Can you answer that question? Why mental health is such a big deal with kids right now?
Mm-hmm. Well, I think the pandemic plays a huge role just because so many of our students were in a developmental stage at the time of the pandemic that it affected them in a way that's different than the way it affected us as adults. Our brains were fully developed during the pandemic. Kids whose brains are still developing.
Some of the brain connections.
Yeah, the connections. So, they're as your frontal lobe is developing, and that's the part of your brain that's making the higher level decision-making type things, the connection from the uncertainty of the pandemic and then how you react to that uncertainty, kind of got miswired maybe. And this is not academic or technical in any way, shape, or form. So, do your own research. But basically, the any uncertainty they feel causes a great amount of anxiety. So the anxiety is so far up because before pandemic, because, that was the main.
Everything was up in the air. We were all like, we didn't have enough toilet paper.
Right. And we have no idea when it's going to end. We don't know if we're going to get it or not. We don't know if you get it, are you going to die? We don't know. We can't plan anything forward. There's nothing to anticipate, right? Which is where kind of like that sense of peace and happiness comes from, is that idea of I'm anticipating something, like school's going to start, or we're going to go to a concert, or we're going to go on vacation. Like in the anticipation is like the joy and the something to look forward to. And we had none of that during pandemic, right? Lots of things just up in the air.
Well, thank you. I didn't consider it that way, but that's what you're seeing with the kids, and that's kind of what you're hearing from them and what you're seeing. Because I'd like people to understand, what are you seeing? What are you seeing with the elevated levels of anxiety and everything?
Yeah. So what we see is just, again, kids, any sort of uncertainty or any sort of, again, there are many, many things outside of our control, right? In everyday life. And so anything that's outside of their control, they can't control, brings them anxiety, which it does for all of us. Again, that's where anxiety lies, is in the things that we can't control. But as adults, we can temper that a little bit with our rational thought process to know, okay, well, my mom's angry, but also, she had a bad day. It's not about me. Mom had a bad day. So, she'll get over it. Tomorrow will be okay. She just needs to rest.
Kids to figure out.
But for kids, it's like, oh, mom's angry at me, and then there's not the next step of rational thought to be able to temper the anger. So the anxiety goes up. So then they are more anxious. Maybe they retreat more, maybe they act out more, whatever it is that the anxiety causes them to do, right? Fight or flight, freeze. Right. And then, now we're in a cycle of problems where,
acting out.
They act out or they retreat. Now mom's more angry, or, mom's got a reaction to it. And so it's cyclical and confusing and hard to deal with. And then it becomes chronic, right? It's kind of all the time. I'm feeling anxiety all the time because there's things everywhere that I can't control. Or I'm feeling depressed all of the time, which is the other reaction because there's so many things out of my control. And there's just not, it's just, again, the brain wiring is where we're having to relearn that. We're having to help them understand
that it's going to be okay. So do you have any success stories that you have, someone that you've kind of seen through a crisis and they've come on the other side and they've come back? Talked to you and said, thank you so much for what you did. I'm an adult now and I've got my purpose and I'm moving forward. And you played a critical role.
So one of my favorite stories, I think, is just a student that I had recently. She came to me initially because her best friend attempted suicide. And she knew that he was going to attempt. He asked her not to tell anyone. And so she didn't. She respected him and she didn't tell anyone. But then when he attempted and she hadn't told anyone, she realized she'd made this huge mistake because she could have lost him. So she carried just an enormous amount of guilt and shame, which eventually led to depression. And so normally as school counselors, we don't work with students long-term. We usually work with students for a few sessions. And then if they need more, we usually refer them out somewhere. But she was very reluctant to see anyone else, and she really needed help. So I was able to talk with her about once a week for almost the entire school year and help her work through her issues she was having. I think you and I talked about this a little bit earlier, and one of the great things that came out of this was she found a appreciation for gratitude and the power of gratitude, and how just being thankful for what she does have, being thankful for, the good things in her life was a huge healing.
It even healed her relationship with her mom, didn't it?
And yes, I mean, it definitely improved her relationship with her parent. She did, have the help of prescription medication. That was huge for her. I think a lot of times kids and parents are very reluctant about medication. We're always nervous about, whether it's going to work, what the side effects are, if I'm going to be addicted. I mean, there's lots of, and she went through a whole range of emotion, like, I don't want to take it. If I do take it, am I going to be addicted to it? By the time she's taking it, she's saying it does make me feel better. I don't want to admit it because that makes me feel shame to admit that I need medication to feel better. And there's so many complicated layers. And then once you're feeling better, she doesn't want to take it anymore because I don't need it because I feel good. But then, a few days of not taking it, now I'm feeling sad again and I don't know why. It's just really complicated,
isn't it?
And these things we're working through the entire time, which was really great. She graduated, went off to college, has decided to become, take up a career in a medical field, is very excited about helping other people and taking that role. And yeah, we're still in contact. She still reaches out to me and lets me know how she's doing, and very grateful for the role that I played in her life. I'm very grateful for what I learned from her as well, because she was good. She was helpful in teaching me some of the important concepts that I needed to practice as a school counselor. So it was a good partnership that we had, learning from each other.
Yeah, interesting. The teacher, when you need them, the teacher comes.
Yeah. So yeah, it's a good. Those are the moments where you feel really rewarded, like, okay, this is why I do this job. And, when you really can see that you've really helped someone.
But you help them on the social, emotional, and mental health level.
Right.
And that's something I don't think people take seriously a lot of times, they don't understand. And so I think what you've been telling us today, I hope is there anything that you would want to leave our audience with to understand more about school counselors besides the name? I mean, I thought that was really good. I'm going to use that now. Guidance counselor versus school counselor. And I'm going to tell people, hey, it's changed. Anything else you'd want to encourage people to explore when it comes to school counselors, questions they can ask, times to reach out?
Yeah, I think that the misconception is that a school counselor is just there to help you graduate and get to college. And again, that is part of our role. But we also, provide a great service in just all of the ways that a student might need support, and especially in mental health. And that's really the part that we enjoy the most, is just being able to help students figure out how to navigate the hard things. So yeah, I think just it would be great for people to know that and encourage their students to come and see us and not feel any hesitation to come and see us for any reason, but especially for any struggles they might be having social, emotionally, or with any mental health. Yeah.
Well, thank you, Kadi, for coming with us today and talking to us about school counselors, because critical role that you play. Thank you.
Thank you for having me.
Hey, I'm glad you got a chance to meet Kadi Tenney, a counselor at Payson High School. She's on the front lines of a crisis facing young people today. She's also been an essential ally for me. She helped me get Ending the Silence in front of students at her school. But we don't have nearly enough trained counselors in our schools, even though the research clearly shows they're essential. Counselors are not just for boosting student achievement or offering college and career advice. Counselors help teach kids how to cope with life. They reduce discipline problems and boost graduation rates. They can also help prevent teen suicide. One study after another shows the huge impact of school counselors, especially when they can provide mental health support for kids and families in crisis. Up to 20% of students experience a mental health condition in a single year, according to the Federal Centers for Disease Control. Moreover, the suicide death rate among teens increased by 40% in the decade before the pandemic hit, and you know it's only gotten worse. Nationally, about half of students have suffered at least one adverse childhood experience, and about 25% have suffered at least two ACEs. That includes things like emotional, sexual, or physical abuse. It also includes family problems like drug addiction and alcoholism, divorce, the loss of a parent, or incarceration. These traumas increase the risk of things like depression and anxiety. That's why we need school counselors. A lot more school counselors. We need about one counselor for every 250 students, according to the research. But guess what? Only 2 states meet that standard, and Arizona is nowhere close. Arizona has one counselor for every 667 students. That's not even close to the national average of 400 to 1. Some 17% of schools have no counselors at all. A Kaiser Family Foundation survey found 1/3 of schools have no outreach programs at all for mental health screening and services. Many districts like Payson used pandemic grants to add counselors, but now the grants have gone away, and they're struggling to hang on to what they've got. Here are some studies on the impact of counselors on mental health problems from a report by the American School Counselors Association. You can find links to these studies on the research section of the strengthbeyondstruggle.org website. The research shows bystander training on bullying reduced bullying in the school. Providing small group sessions on positive behavior reduced behavior problems, suspensions, and lost school days. Counseling sessions with families reduced hyperactive, defiant, and aggressive behavior. Counseling also improved parents' management skills. One national analysis studied schools with counselors focused on mental health services for younger children. Those schools had higher test score gains and lower rates of problem behaviors. Isn't that what every teacher wants? Teachers in those schools reported a better school climate and fewer problem behaviors. That included fights, cutting class, stealing, and drug use. So counselors like Kadi Tenney play a vital role in student success, but only if they have the time and support from their administration and parents. We know now that healing depends on ending the silence, and talking to your school counselor is a great place to start.
It's okay to just be me. We're all made to be unique. It's okay to have my needs. It's okay to be me. What's easy for others are struggles for me. I do things differently. Doesn't make me broken. It just makes me me. People out there, help me through ones who care about me and you. Through my struggles I find my strength. Feels so good to be me. What's easy for others or struggles for me, I do things differently. Doesn't make me broken, it just makes me me. People helping me to get through have their own struggles too. Even though they have their strength, they are human like me. Through these struggles we build our strength. We all want to feel healthy. Even though we make mistakes, struggles build our strength.